Hi, Dr. John Chuback here. Today I want to talk to you about lymphedema. Lymphedema is a very important subject, and it's under-recognized and largely misunderstood. Medical doctors and healthcare professionals of all kinds get far too little training in the lymphatic system and the complications and workings of the lymphatic system. So today I want to just take you through it in a very simple layperson's kind of language to hopefully raise awareness and help educate all of us about the lymphatic system. The lymphatic system is fascinating, first of all, because it's part of two systems of the body. First, it's part of the circulation or the circulatory system, and second, it's part of the immune system. So let's talk about the immune function first, because this is the area I think most people are most familiar with. Lymph nodes. So lymph nodes are a part of the immune system which trap foreign bodies, bacteria, fungus, viruses, cancer cells, all kinds of bad things that get into the human body and need to be eradicated. And the immune system has its function of identifying, capturing, and destroying these things through a system of antibodies, white blood cells, and this destructive mechanism which rids our body of these pollutants and poisons and dangerous elements that can somehow get into our circulation. So that's one of the key aspects of the lymphatic system, is the immune system. But how do these elements, these foreign invaders and inborn cancer cells and things like that, how do they get to the lymph nodes? Well, the answer is very simple. They get there through a system of lymphatic vessels, okay, or lymphatic channels. But they're actually very, very tiny, thin-walled vessels, and they're part of the circulation. Now let's talk about the circulation. The circulation has two major components that most of us are very much aware of, the arteries and the veins. Arteries generally carry red blood or oxygenated blood to the tissues to keep them alive and to give them life, because oxygen is mandatory and essential for life. On the other hand, the veins carry the blue blood away from the tissues, the deoxygenated blood away from the tissues and back to the heart and lungs for recirculation and for reoxygenation, to get loaded up with oxygen again. Now, there is a third component of the circulation, and that third component is the lymphatic vessels. And the lymphatic vessels are there surrounding the tiny little arteries and veins at the microcirculation level, at the tissue level, to sop up or sump up or suck up the excess fluid that leaks between the tiny little arterial capillaries and the tiny little venular capillaries. And at that little microcirculatory interconnection, there are tiny little gaps. And the blood cells are too big to get out of those gaps, so they pass from the little arteries to the little veins without a problem. But fluid, what we call serum and plasma, is thin enough and small enough to leak out into the soft tissues. And when that happens, we get a buildup of fluid in the soft tissues. And that buildup we call swelling. In medical terms, of course, we call it edema, kind of fancy word for the same thing, a collection of fluid in the soft tissue. And this can occur anywhere in the body. It can occur in the legs, it can occur in the upper extremity, the arms, it can occur in the face, the neck, the breast, the buttocks, the intra-abdominal area, the intrathoracic area, inside the chest, inside the belly. Fluid can collect anywhere in the human body, even in the private areas, the genitalia, the scrotum, the vulva, etc. So this is a very, very important problem, and it needs to be recognized and understood. So the little arteries bring the oxygenated blood to the tissue, the little veins take the deoxygenated blood away, and then there's this leakage of fluid into the soft tissues, a little spillover, a little spillage, which is normal to happen. And there you have all those blood vessels surrounded by the little lymphatic blood vessels, and they're very, very essential. And I like to make this sound effect because it's fun, but it's also effective in teaching. It goes, it slurps up all that extra fluid like a sump pump would. And that sump pump then returns the fluid to the venous circulation. And generally that happens right here by the collarbone on the left side. And that's where the lymphatic fluid re-enters the veins. And then the veins there are very close to the heart, and it gets over to the right side of the heart, which then goes out to the lungs for oxygenation again. So the fluid gets added back into the bloodstream to keep the blood nice and thin and flowing nicely. So this is the normal function of the lymphatic system: immune and circulatory, and to keep our tissues nice and dry and free of any swelling and edema. So then what's the problem? Well, the problem is that the lymphatic system can sometimes malfunction. And there are two general categories of lymphedema: primary lymphedema and secondary lymphedema. Primary lymphedema simply means that the individual is born with what we call either an aplastic or hypoplastic lymphatic system in one or more areas of the body. What do those terms mean? Aplastic: there has been no formation. It's completely absent in an area of the body. Hypoplastic: what does that mean? There's been a diminished or less than optimal development of the lymphatic system in a particular area of the body or more than one area of the body. So one is an insufficient system and one is a completely absent system. So a child can be born, an infant can be born with an aplastic or hypoplastic lymphatic system, or a system that might be adequate in number of vessels but not functioning normally, dysfunctional lymphatic system. So these are all examples of primary lymphedema, something that you're born with. Secondary lymphedema is, generally speaking, in the case of somebody who has a normal lymphatic system but somehow becomes injured and becomes dysfunctional as a result of some problem. Typical examples of that would be surgery, where, let's say, for example, a lymph node biopsy needed to be performed to see, for example, are there cancer cells growing in this enlarged lymph node? So the surgeon, like myself, might make a small incision and cut that area of lymphatic tissue out to look at under the microscope. Well, that biopsy, excisional biopsy we call it, would cause damage to the lymphatic vessels. And that damage can cause scarring in the lymphatic vessels and therefore not enough flow, and you might wind up with a swollen limb. Perfect example would be after breast cancer surgery. A lymph node or two or more could be taken under the arm in what we call the axilla, or the axillary group of lymph nodes, and a patient, male or female, could wind up with a swollen upper extremity. Another example would be lymph node biopsy in the groin area. Let's say, for example, after a melanoma, a skin cancer of the lower extremity, to see if the melanoma cells, the cancer cells, had spread to the groin lymph nodes, which is a fairly common thing. An incision would be made in the groin, and the lymph nodes would be removed, damaging some of the lymph vessels, and a patient could wind up with a swollen lower extremity. Another example would be radiation therapy to the lymph node area in the groin or in the neck or under the arm for cancers that had spread to the lymph nodes, and now the doctors want to eradicate that cancer using radiation therapy. And radiation, as you know, can cause damage, can cause burning of tissue, etc., and that can disrupt or destroy additional lymphatic vessels. Traumatic injuries can do the same thing. If there's an accident, a laceration, physical injury to the body and to the lymphatic vessels. Another cause would be infection. We don't see this in the United States very much at all. It's extremely rare, but in underdeveloped countries throughout the world, we may see parasitic infection, worms and things that can clog the lymphatic system and cause a massively swollen leg, something we call elephantiasis or upper extremity. So this is just a very rudimentary, introductory discussion of the lymphatic system, how it works, what it is, what its normal function is meant to do in helping us, and then a little bit about the early disease states. For example, myself as a vascular surgeon who specializes in venous problems with the veins, one of the areas that I commonly see lymphedema is a secondary lymphedema called Phlebo-Lymphedema, where you have venous insufficiency, so the veins are not working properly, so blood is pooling in the legs, fluid then collects in the soft tissue and overwhelms the lymphatic system, for example. So the patient winds up with a swollen lower extremity from vein problems that overwhelm the lymphatic system. This is called Phlebo-Lymphedema. Phlebo meaning veins, lymphedema referring to swelling of the leg because of a dysfunctional lymphatic system. So we have much more to discuss. I'm glad to spend this time with you. I hope that you listened to the end. It's been many, many years of study to understand these things this way, and it's my privilege and my pleasure to share my knowledge with you. Thank you so much.